29th of April 2015, Professor Olaf Wilhelm visited our hospital and met with Principal Investigator Professor Igor Bondarenko. They discussed some important issues within the frames of clinical trials. Professor Bondarenko made site facility tour.
This is Olaf here, professor of Munich University and also the work in industry of clinical trials as well. That's why welcome once again. This you see this center, Ministry of Health of Ukraine, City Clinical Chemotherapeutic Center and Clinical Diagnostic Laboratory. They are located here. So we really invest the own monies for that. No government coverage, no hospital. So the hospital really, they said, if you're able to something add, not ask not ask the hospital to help, because you know they said we cannot, we may only permit something. That's why really we rebuild this area absolutely for ourselves, but it was really necessary to be successful in trials.
So what kind of research you do?
All oncological research. I mean, all clinical trials, all areas except not include hematology. This is automatic hematological equipment. This one with the special trials where we have the neutral liquid formula automatically do few seconds very quickly works. So the biochemical analyzers, the main and the backup, the coagulation and electrolytes performance. These places are specially for the patient. I have two videos. The explanation about informed consent and about the general principle of clinical trial performance. It takes like 40 minutes. So when they prepare the study drugs over here, the chemotherapeutic agents and the agents for supportive care over here. So may I introduce this place? So this is very important. It's Eugenia is the pharmacist. She's responsible for checking all the process, and she is responsible to know exactly that the patient will receive correct drug for correct trials and without any mistake. So you see two video systems, one and there, and everything is recorded over here. We established it specially because to ensure the real openness of our activity. Everything was rebuilt, as I said, 1 year ago. 40 beds, yeah. But they rotated every day 50 patients, you know, and 1 week 300 patients, 300. That's really interesting. You know, when we are overloaded, we rebuild something new. We all the time try to change something to improve. You know, it is like a routine machine, routine chair for the like for chemotherapy. We used another one. You see, the patient for 1-2 hours infusions. They prefer to, and you know, sometimes the patient cannot lie on the bed. They sometimes prefer to sit over there. We were asked with the patient to ensure sitting mode of chemotherapy. So, and 7 additional beds in time like today when we are really overloaded. So we use such facilities for 1-2 hours. We ask the patient, what you prepare? They said, okay, we will be here. Very actively try to show you the site, maybe to make you aware with our general principles and so on. And we received absolutely perfect explanation of this trial's activity, the goals, everything what is related for that. Thank you so much for this stuff. You really work intensively. I think that some disappointing which were with screen failure rates may be overcome. The new version is also very important, and I believe that everything may be make us more successful. Thank you once again, and may I just ask you a few words about your general impression, and please feel free.
No, for me it's actually really the first time in Ukraine. I never was before. Also was very impressed at Kiev yesterday. But first of all, I want to thank you very much for your hospitality. But on the other hand, I was very much impressed because that what you showed me, also the way you are managing things and also the infrastructure, I think there's nothing better in Germany. Where I'm coming from.
We will not compare the principles in Germany and how
because
they say
that is really first great of really infrastructure to clinical trials. And that was, thank you very much to have this round and also to show me all this infrastructure you have set up here, and this is very, very good. I congratulate you for that.
Thank you so much. It's very important for us. And do you think, does it correspond for the high requirements of the sponsors in with coincidence with GCP principles we just now fought?
I think the data also showed that your site is pretty active. I can only judge now the clinical trial we're right now doing. But we know the infrastructure is one important part. I think but the people are more important, because the more accurate and dedicated their work, and this seems to be the case here, the better the data at the end of the day. And so I think it's a combination of both. And so, to be honest, I was surprised. In a way, positively, very much surprised.
Very much surprised. I just, we are near the finishing just now, because I know that your airplane just now preparing.
So will not wait for me.
Yes, they will not wait. Never. Thank you so much once again for you and for the company. We will try to do our best to improve our activity just now. I believe that quality of data we just don't not discuss, because we do it every day, and Sergey is responsible for this process. Thank you so much for this activity. And finally, Olaf, thank you once again.